What's up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have a very special guest who is by far one of my favorite ozone mentors, people, and just general humans to work with. So this is Kim Look. She is one of the innovators, greatest of ozone therapy, and as far as the training goes with that. She has worked with a formerly known group as SOPMed, which is now changing its direction into a training company called MedMasters. She has worked in tons of integrative practices, has lots of experience when it comes to dealing with chronic disease, infection, and autoimmunity, and then a special focus in optimization and human performance. She has spent 5 years as a patient liaison for medical tourism in Honduras and Mexico. She has owned 3 practices and has worked with hundreds of doctors nationwide to build their IV space and grow their business. So basically, she's amazing, and Min loves her because she talks about the business side of things in a very unique way. She has had the pleasure of personally administering over 2,000 IVs in the course of her career, witnessing the power of integrative therapies firsthand. So welcome, Kim.
Hey, thank you, Lexi. It's
awesome.
Fun to be with you always.
Always. We always have a good time. Yes. So let's jump in. Really, the goal of this podcast episode is to kind of talk a little bit about our collaboration together. I'm always honored to get to work with you guys, just because you guys are just great people. You and Vicky, Jace, the whole team. The whole team is great. So tell us a little bit about kind of your background with SOPMed and then kind of the transition into MedMasters.
Yeah, so many of you or any viewers, any practitioners out there, we've been with SOPMed, or SOPMed was a group that we really worked with. I worked with them for over 10 years. And it was a group that still was designed to help train and teach practitioners on ozone and ultraviolet light therapies. And we really built that and grew it, loved it. And then we had to transition. Came down to just different regulatory aspects of working with a training company integrated with a manufacturing or an equipment company. So we really just had to change that. But we also were super excited about that because it allowed us to expand. It allowed us to get into other scopes, other therapies, and we are super excited about that vision. So MedMasters is now replaced SOPMed. That means SOPMed is gone. It's not like it's out there somewhere and you can still utilize it. That was a choice we made, and I know it can be confusing, but we went into MedMasters and we still teach and focus on ozone and ultraviolet light therapies, but we also get to expand into much more in the coming years. So it's a lot of the same team, a lot of the same fundamentals, and other things totally changed in terms of how you get access to it, and the name completely changed. So yeah, we don't confuse people, but it was some regulatory stuff and just some changes that need to be made.
Right. So practitioners can still get trained in ozone therapy. And absolutely. Yes. And so I think that's the important piece. And so I'm not doing the ozone training. Kim and her squad is doing the ozone training. And this is why this collaboration is going to be fantastic, because we're both very passionate about teaching, education, and we like to make it so fun. So next, let's kind of jump right into why Masterminds and why YDH Academy? Like, why did you choose this platform to do it?
Well, I think you and I align on so many different premises in terms of techniques and modalities and an approach to healthcare, and that transcends into our businesses, whatever they may be. But then it gets into teaching practitioners some of these same ways of thinking, and I think it's now way beyond functional medicine. It gets into foundational medicine. And even beyond those scopes in terms of just like really cutting edge outlooks on how to not just optimize, but just live differently for our patients, right? But then when it gets into the teaching training side, I think that we really align because we both know, and it's my group and your group collectively, that you can go as a practitioner to learn about a concept, but then you have to bring it back to your practice. And I actually feel like that is by far more work than going and learning about a certain whatever technique or piece of material or hormones or gut health or whatever, right? You got to take it all and transition it into your staff and then your patients. And then that has to all cycle really, really well. So I think you've got some taglines and some different ways of expressing that. But I think both of us really align with giving practitioners the functional, tactical, implementable, comprehensive tools to really, make it effective in your practice. Without that, you can't really affect patients at the highest level.
Absolutely. One thing we always say as we interview new practitioners to join our practice is that, they always say, I love to learn. Part of learning is you go and you listen and you understand it. But the other part of learning is the application part of it, because that's where your then clinical expertise and experience grows. And that's how you get more innovative and all those things. So I think that's awesome. I love the idea of hands-on. I'm such a hands-on learner personally. And Kim got to be on the receiving end of some of my training as far as injectables and things like that. So we're so excited to partner together, and the format's going to be amazing. So some of the things that I'm going to be covering in the mastermind is some of the things that I feel like we're kind of on the innovative side of. We're at the cutting edge of aesthetics, meeting regenerative medicine, ozone, and peptide. These are all very big buzzwords right now as far as regenerative therapy. Well, what does that mean? Basically, what our goal is to teach practitioners how to trigger those cascades where we can regenerate your own tissues and your own ways of improving growth hormone, angiogenesis, increasing blood flow, supporting mitochondria, and all those things. So one of the topics I'm going to be covering is hair restoration, which I think is such an important topic for so many reasons. We see it for thyroid, right, which is a big part of our practice. We see it for HPA axis dysfunction, so people who struggle with cortisol regulation. But really, there's two big things that I see it a lot more now is post-COVID, so post-viral COVID infections. And then with our peptides, semaglutide, tirzepatide, these GLP-1s, the lack of amino acids that people are intaking on the nutritional side of things, their hair's falling out because they're not eating enough or they're not getting enough of those amino acids. And so we see it and they're like, oh, I think my hair's falling out because of semaglutide. And I'm like, I'm going to stop you right there. It's probably not the semaglutide. You're probably not eating enough protein. And then I put them on the InBody and I show them, I'm like, okay, here's what I'm seeing. And so I think it's very much important to approach it from a comprehensive, holistic approach, looking at all these things, the InBody, what are they taking in their gut? What other peptides are they on? What are they doing from a gut health perspective? So I'm going to cover how to address those things. I'm also going to get down into the nitty-gritty details of what products do we use. So comparing things like PRP versus PRF versus advanced biologic or growth factors and why we'd use those kind of thing. And then how do we layer peptides with it? And then how do we layer ozone with it? So I'm going to be covering that. You will walk away with my protocols, my consents, my SOPs, basically like the little recipe book on how to make this magic happen. It's your kind of job to then take it and run with it. The other topic I'm going to be covering is our scar regenerative therapy process. So this is another thing that we do for all kinds of scars. Can be stretch mark scars, can be mommy makeover scars, can be, gallbladder scars, all kinds of different scars. And again, using those same premises and principles that we understand as far as down to the cellular medicine, triggering VEGF, increasing angiogenesis, improving blood flow, supporting oxygen, improving cell turnover and collagen production. So I'll cover the process of how we do that. Who's your good candidate? How many treatments are they going to require? What's the prep? What size syringe? How much do you inject? What are you looking for? All those things. And then the other topic that I'm going to be covering is microneedling. So microneedling is something we do a ton of on the aesthetic side, but we also do it with aesthetics and scar therapy. So microneedling, we'll go over how that works, products to use, the prep on that, the aftercare, and then really focusing on collagen induction therapy is what it is. So we're creating tiny little microtraumas to the skin, which then triggers the cascade of events to kind of improve the cell turnover of that. Kim, do you want to talk about what you're going to be covering?
Oh, you just mentioned so much. It's like I'm trying to keep up with you and my thoughts in regards to that. I think you use some really good terms: regenerative, innovative, these products and everything it takes to truly get the protocols for your practice, right? And you're looking at so many tools in terms of ozone, in terms of peptides, in terms of PRP, whatever, these other products you've got to stimulate regeneration. But the other part of this, and you mentioned gut health, you mentioned hormones, is the IV side that actually can really go well with this in terms of aesthetics and optimization and anti-aging and health, right? Gut health. And so I definitely want to partner with you in the conversation on how to do this systemically and what simple tools. This is not a comprehensive IV course, right? These are like some of the basic things that you can bring in, but really, are synergistic with the things that you're doing. So we're going to focus on methylene blue is one of those quick topics, but also simple IVs that you can bring in. It's a hot topic, right? People are talking about it. You can get it in IV bars and whatever else. So if you're interested in that simple technique, and we're talking about core principles of mitochondria health, right? Cell biology, the things that really can not only help maybe reverse some aging, but also it can treat disease, but we want to be on this like proactive side of things for the patients who really are out there looking to extend their health and their beauty. Then glutathione, that is a big, for years, decades, even in Asian countries, et cetera, they've been using glutathione in terms of skin health and skin coloring, et cetera. Yeah. But it's also one of the top antioxidants, right? It can definitely help with detoxification. Lots of benefits there. And then one of the real rare things I don't think many people talk about anymore is procaine. And I think that I introduced it to you. Yeah. And you've really taken off with it. But yeah. I've known about procaine for a long time in terms of aesthetics, in terms of nervous system reboot, scars, and actually like dealing with, there's some Eastern medicine methods or techniques in terms of releasing energy or emotion through scars. So we can make them look better, but we can also improve the health of our patients with that, and even do procaine IVs. And then of course, ozone and ultraviolet blood irradiation, which is again, great for healing, great for underlying infections, great for boosting mitochondria and ATP production, et cetera, like a lot of these other things, but definitely gives us more energy, gives us more, ability just to live day to day in a better way.
So quick teaser, because I'm always innovating. We have just gotten our hands on some topical glutathione with some ascorbic acid. So my goal, and we just ordered it. So my goal is to have some before and afters and a protocol for that. In that it is going to potentially, in our practice, from a clinical standpoint, maybe replace hydroquinone, which is what we use in like melasma, skin brightening, those kinds of things. We're going to do some test running before we get there, and then potentially getting into some topical methylene blue. So my hope is to have some bomb before and after pictures. So you're going to get to see it, as we progress. So that's going to be so cool. And then as far as the details, so this is going to be the day. Oh, Angie done erased my board. So it's going to be, I turned around. So it's going to be May 3rd and May 4th. It's going to be in Noblesville, Indiana at YDH Training Academy, which is housed in UDirect Health here. So we're going to limit it to about 12 to 15 people. This will be a hands-on opportunity, which you can't say that for many conferences. And I know because I go to conferences all the time. And so this is going to be one of those where you're going to want to sign up prior, let us know what you want to get your hands on. The beautiful thing is we have multiple treatment rooms in my office. So we will get you the opportunities and all the experiences that you want to on the procedural end and the receiving end. Or if you're going to bring a spouse or, you've got a staff member that you're bringing and they want to get treated, we need to know so we have enough product. But that is something that we can do, which would make great marketing material for you as a practitioner because you're going to have before and afters. See how Kim and I are always thinking about the business side and the marketing side. And so it's almost like a double-edged sword, don't you think, Kim? It's like our strength, but also like our weakness at the same time. So it's a 2-day training event. It's going to be jam-packed. I've got a lot of my staff who are going to be jumping in and helping. So Leah, who's my procedure nurse, and so she's always like, she's like, I don't know what you're doing, Lexi, but let's do it. Like, she'd ask no questions. She's like, I'll do it with you. So she is going to actually do some of the neurotherapy training as well. She's like the ozone extraordinaire. So she runs all of our high dose and our standard ozone. So as people want to ask questions or they want to ask staff, and if Kim and I are kind of tied up, we've got multiple staff members who are here to help. And then our aesthetic nurse is going to be covering the microneedling section. So you're going to hear it from like the point of view of someone who does aesthetics day in and day out. So I think it's great. It's great. It's kind of cool because in our YDH home, we've got all these like little tiny specialists on little areas of what they do in practice. And then my hope is as practitioners, you can kind of take that like, okay, you're heading up aesthetics and you're heading up IVs. So we've got that. Day one is going to be didactic in the morning. So and if you've ever heard Kim and I talk, we talk really quick and there's going to be a lot of information. Although we've got Vicky and Angie kind of help us because they're going to give the paper materials and the notebooks. So it's like, take notes, slow down. And so we're going to cover didactic in the morning, and then we're going to have hands-on in the afternoon. And then day two, we're going to have, and I would tell you exactly what we have, but Angie erased my board. So I don't know off the top of my head. I can't remember what it was. I think it's like IVs maybe on day one, and then IV experiences in the afternoon. And then day two, I think, was aesthetics. And then it's like hands-on, I think. It was something like that. And then on day two, we're also going to have Min Yu speak. I don't know if you know who Min Yu is, but he was also a chief of excellence. But he's going to talk on the business side of things and, setting up some of those business type pricing packages, bundles, and kind of what that looks like. And what did he say, Kim? He's like, I can tell you, what did he say? Lexi can tell you the art of doing it, but I'm going to tell you the math or I don't even know what he said.
Yeah, the math of it. I really think that's what it is. There's an art side to doing your business, and then there's also the technical formula, right? Like how to, what is this costing me in supplies? What is this costing me in staff? What is this costing me in space? And then how do I create a system and program around those prices to where we can make money based on your artistry of putting the protocols together?
Yeah.
So the thing with you guys is just, you wonder, like going to conferences, you could hear all these people lecture, right? And you wonder, what does your actual practice look like? Are you as organized? Are you, do you have a booming practice? Is your staff really happy? Are your patients really happy? How many patients do you really have? And the thing is, when you come to this conference, you'll see that Noblesville, Indiana has like the one of the best top tier practices because it is truly, they practice what they preach. So you'll be able to see that live, not just how to inject somebody's face or how to do an IV. And by the way, you'll have the option of getting an IV. We've got, support in terms of supplying these products. And so if you want to experience a methylene blue IV, an ozone IV, we'll have that too. But you will get to see how true business sense in terms of marketing, Men is so great at, like you are too, at AI, right? Innovation, medicine is way behind. Even the way most people practice in terms of science is 20 years behind the current studies, right? So what you'll see here is the way to take what's currently happening, what is currently available, tools, etc., true implementation for a full service experience in Indiana.
Yeah. The other thing that I think is very appealing to many of the practitioners coming is we're going to give them some take-home gifts. And those take-home gifts are going to be things like they ask me for all the time. Can I see your consent? Can I see your SOP? Can I see your patient education tool? So we have kind of collaborated our efforts together. And so we're going to give you a leg up on innovation and incorporating this into practice, and that we're going to give you what ours looks like and allow you to basically kind of set it up as a way that you can build on that or tweak it to whatever best fits your practice. It's not legal advice. You have to verify it as well. But I think when we were building this out, I was like, where the hell was this shit 5 years ago when I started doing it? There was nothing like this that existed. Nothing. So this is definitely going to be a jam-packed 2-day event that I think is going to be amazing. I'm so pumped. I'm so pumped.
You say a step up or a leg up. That's 100 legs up. Again, what do you do with all this when you get back to your practice? You have to create all this stuff. And you're right. Where the hell was it? That's where MedMasters is so passionate too, is providing all of these details so that there is no lag between I learned something cool to my patients can experience something cool. But you've got the liability, the legalities of it that are important. You can't skip it, but can really slow you down. So this is you will get so much, but you will be able to implement very, very quickly.
So I have this thing in my office, kind of my mindset is that if I'm going to a training and I'm learning something new, I already have people booked on my schedule for whatever that procedure is or whatever that test is for when I get back, because the best way you're going to learn it is you got to learn it and then you got to do it like a couple times while it's fresh in your mind to kind of like work out the kinks. And then I kind of then teach the practitioners in my practice because like I already figured out the kinks about it. So my best advice is if you're coming to MedMasters and you're going to be doing hair and microneedling, like really try to get those people on your books within the next like 2 to 3 weeks while it's still fresh in your mind. The other thing that Kim and I are going to provide is a list of vendors of where you can get these products. Cause that's always a question like, well, I'm like, Kim, what state are they in? I don't know. So we'll get you who the vendor is for the microneedling pen, who to get with for cannulas, procaine, peptides, the IV stuff, all your ozone materials, all those things. So we're literally giving you
some deals for you in those.
Yeah. You're going to get the keys to the kingdom. So it's really important to come. Okay. All right, Kim, I think that's it. Is there anything else important that you think we should touch on? There's a discount code for the hotel. So we've got that. We're about 45 minutes north of the airport. So, you might want to rent a car. The hotel is super.
Come to CrossFit with us on Friday morning. You can't. Right?
If you want to go work out, you can do that too.
You can keep up.
Bring your listen. Yeah.
I saw you do 11 pull-ups the other day on social media. So I did 9 yesterday, but I was like, damn it.
Yeah.
Lexi's still beat.
Yeah. Yeah. So my goal is to try to get 15 in by the time I'm 40, which is going to be in August. So I got some work to do, but that's okay. All right.
The 5, but I can't do 15 all at once.
Yeah, it's hard. It's hard, but grip strength, it's a marker of longevity, and I plan to live forever. So, all right, Kim, I think that's it. Is there anything else? I think no.
I think those are the teasers. Those are the key points.
Key points.
Where to go? I think at this point you got to go to medmasters.org.
Oh yeah, yes, the handles. Mm-hmm.
And then there is a tab there for aesthetics and ozone or aesthetics mastermind.
Yeah.
You can click there to purchase. There are 2 different prices. If you want to be an injector, hold the needle, you've got to provide your malpractice, your licensing, so we know you're qualified there. If you don't, there's a different price there. So that's what you'll see when you get over to MedMasters. You click on it to purchase it, decide what you want, and then you'll be able to provide the information you need depending on what you chose. Then there's also all these options in terms of getting treatment, whatever you might want. So we're going to ask you a bunch of questions on what you might be interested in there so we can book. You guys will be the patients as well as the practitioners. And then once you purchase, you'll get all sorts of, emails on all these details.
Perfect. Yep. So on Instagram, you can find them at what is it? Masters of Healing.
Regenerative healing.
Yes. I'll tag it in the show notes and I'll tag it on Instagram. And then Kim is not super active on Instagram, which I'm real sad about it because I tag her literally all the time. But it's okay. I'm just going to have this like one-sided relationship on Instagram and I'm just going to keep tagging her just so people know who she is thanks to me. And then maybe one day she'll embark on the gram. So
I just got to have you teach me. Got to teach you. I hired some people. I'm getting better at it.
I hired some people. Okay. All right. Perfect.